Do you have a specific protocol that you do with all of your new patients, or you just look for the low-hanging fruit? 75% of all patients are referred into the hygiene room. So when they meet the doctor for the first time, they're getting their teeth cleaned. The doctor comes in, says, oh, that tooth needs a crown, schedule them for a crown, and we don't do comprehensive care. In our practice, they can't come to see the hygienist at their initial visit unless they have a comprehensive exam first. Sometimes they do get a cleaning at their first visit, but I'll see them for an hour before then. And if they just need a prophy, we can do a prophy. But if they need scaling and root planing, they'll be scheduled for scaling and root planing, and that will be the first of 4 one-hour visits of scaling and root planing. So let me talk to you very quickly about the 4 phases and the 5 protocols of treatment. The 4 phases, which we've talked about in our previous video, was exam, diagnosis, treatment plans, and treatment. That is done on all patients. Once those phases are completed, or during the middle of those phases, I'll explain to the patient what the 5 protocols are. So here's a little practice management tip. At the initial visit, I say to a patient, you're very lucky that you're here because you're in the right place. They don't know what that means. Why do I tell them they're in the right place? Because people like declarative sentences. If you declare something like, I'm not a very good athlete, or I am a good athlete, or I'm a big eater, or I'm a good cook, people sort of tend to believe you. So when you say to somebody, hey, did you lose weight? They go, oh, thank you very much. Or I like what you did with your hair. Really? Did I do anything? So they start to think something positive. So when you say something positive to another human being, the mind is such that they're not going to deny it. They may act like they deny it, but deep here in the amygdala, they're going, I feel pretty good about that. So when a patient comes into our practices, they're scared. So I say to them, hey, I'm glad you're here because you were in the right place. They already feel a wave of relief. I go, here's what we're going to do today. We're going to do an exam and a diagnosis. I'll give you some treatment plans. We're probably not going to do treatment unless you're in pain. Are you in any pain? And they're going to go yes or no. If they're in pain, we take care of their pain. If they're not in pain, then we go on to the second phase of care, or what I call the protocols. So let me tell you about the 5 protocols. 1, eliminate pain. You only do that at the first visit if they are in pain. Second protocol, eliminate infection. You begin eliminating infection before you do comprehensive treatment. You don't do implants, you don't do bridges, you don't do ortho if there's active periodontal infection or caries. Those are the 2 main infections in the mouth. And we have 3 billion people on the planet, 4 billion people on the planet that have active periodontal and caries infections. It's probably more than that. Third and fourth phase are frequently combined. That is functional rehabilitation and aesthetics. We combine those together because they're done at the same time. Oftentimes we do the functional rehabilitation first, move the teeth in the right place the implants, place provisionals before we do the aesthetics, which may be veneers, bleaching, and final crowns in the front of the mouth. That is done at the last phase of treatment. And then number 5, which is really important, probably the most important phase of care is, you said it, I'm listening, maintenance. If I do not tell my patients at their initial visit that maintenance is the most important phase of care, guess what? No matter how good my treatment is, it's not going to last. Now, I've given you some statistics before, and I don't know if I said it the last couple of minutes, but I'll tell you this. 75% of all practices do not do comprehensive dentistry because they don't do a comprehensive examination. No periodontal probing, no full mouth stairs or radiographs, no oral cancer exam. Maybe they'll look at 1 or 2 teeth that need to be fixed, but it's just not done. They look at 1 tooth, they send them to the endodontist, do the endo, but the tooth may be tipped, there may be a 9mm pocket, the bite may be collapsed, but the endo's done, and then I'll see the patient after the endo's done on a hopeless tooth. It's because it wasn't treated comprehensively. I try not to do any treatment until I have a restorative treatment plan, a periodontal treatment, and an aesthetic treatment plan, an orthodontic treatment plan if it's necessary. All that's done, guess what? Before treatment, not during treatment. I don't try to figure this out as I'm building the house. So in this house that I'm living in here, they didn't start putting up this wall here and this wall here and this window here. They had a plan. Most dentists are not planners. We just do what we see. And when that's because the patients are saying, I just want this 1 tooth taken. I don't want a full mouth rehabilitation. Well, guess what? It's our responsibility to have the hard conversations with our patients. Just as if you're a parent, you have to have the hard conversations with your kids. It's 5 o'clock. Dinner's going to be at 5:30. I want ice cream. You can't have ice cream because we're going to have dinner. But Dad, I want ice cream. Sorry, we're having dinner. My patients say, hey, Mike, I want this tooth fixed. I can't treat that tooth because you have periodontal disease, you have caries, your bite's off, and you have an abscess here. Those conversations have to be had. And I break it down very, very simply. I go to the textbook and I'll pull out a textbook. It may not be a textbook. I'll just pull out a book like this. I go, the textbook, this happens to be Isaiah 53 Explained. I don't know what this is doing here. It was given to me as a gift. I pull out the textbook. I go, textbook says, what I frequently, one of my friends or colleagues, Bill Becker, who was a famous periodontist that's passed on, he used to have a book in his room and he wrote textbook on it. It was a book that was covered in brown paper, paper bag, and he wrote textbook. And he'd pick up the book, he goes, the textbook says, and then he'd make up whatever he wanted to say. And what I will tell patients is the textbook says I have to do a comprehensive examination, give you a diagnosis, give you treatment plans before I do treatment, and I have to treat you with these 5 protocols: eliminate your infection, get you out of pain, functional rehabilitation, aesthetics, and maintenance. If I don't tell my patients those things, I'm not doing my job and I'm not being a gift to my patients. So be the gift to your patients and follow that protocol. Here's why I want you to do it. Because you'll be a better dentist and you'll be better to your patients. You'll be busier, they'll be happier, your team will be happier, everybody wins. Have a great day, everybody. Remember, be the gift.